done, in the headlines done. Time for us to get on with our fast conversation this Wednesday morning. Our focus being on neglected tropical diseases, trying to better understand what kind of diseases are this and why they get that connotation, neglected. My guest is already here, Wyckliff Omondi, who is the head of vector-borne and neglected tropical diseases at the Ministry of Health, will be helping us unpack all this. Karibu sana to the program.
Asante sana.
Now, let's just start by first understanding what neglected tropical diseases are.
Thank you so much, Doreen, for hosting me in this conversation. Neglected tropical diseases is a group of diverse conditions, and the WHO has listed, World Health Organization has listed about 20 diseases under the umbrella of neglected tropical diseases. Now, the diseases are given the name neglected because for a long time they've not been prioritized in very many levels. So again, the diseases affect mainly the poor, but I would use that term poor selectively, because at times you will find that there are those others that do not look at the economic status of individual. Again, as the name suggests, they are mostly found within the tropical belt of the world. So Kenya, Africa, and many other continental countries that are lying within the tropical belt of the globe are affected by these conditions. They affect many people globally. Close to 2 billion people are affected by these neglected tropical diseases. If we narrow down to Kenya, more than half the population of the country is at risk of these diseases. So probably, maybe just to highlight, out of the 20 neglected tropical diseases, how many are in Kenya?
All right, and we'll just get to that in a bit as we continue apace with this conversation. But let's retract a bit. And you've mentioned that term neglected simply because also it has that sort of quote unquote, yes, you mentioned it's selective, but a preserve of the poor. I mean, just aside from that, is that the only factor that makes us to describe this?
Medicines that probably will not be bought by the poor people, so they will not break even. So there is low research into these particular diseases. Again, that is what is making them termed as neglected. Number two, not all, but majority have got less severity in terms of the symptoms that they express.
All right.
So even at individual level, you may be impacted by these diseases, but because the severity is less, you just neglect it. So you continue with your daily chores, doing every routine, but the impact, the long-term impact, is massive. So those are some of the factors that contribute to the term being neglected.
So clearly there's obviously other underlying factors
Sure.
underneath the fact that we could refer to them as neglected. Now, let's come a bit to try and understand why, there's so much in the African continent. I know also in Latin America, in Asia, but what is so peculiar about Africa as a continent that you'd find quite a number of these diseases just, inhabiting the African continent?
So, as I indicated first, the diseases are within the tropical belt of the globe. So it's not only in Africa. You will find it also in other global parts of the country that lie within the tropic. Most African countries are within the tropical belt.
Okay.
If you go to Asia, you will find it also going across the continent stretches across the tropical belt, South America as well. So those are the countries that are outside the belt are not impacted by these diseases. So by the virtue that we are located within the tropics, then that means that we will be impacted by quite a number of these conditions that have been listed among the neglected tropical diseases. But of course, we cannot run away from the fact that most African countries are still developing.
Yeah.
And some of the risk factors for acquiring these conditions is poor hygiene condition, and that is cutting across many African countries. Environmental conditions are not very conducive, so they enhance the thrivement of this particular condition.
Right.
So I think the fact that investment towards those areas have not been very massive as in the developed world, then you will by correlation, then you will find the magnitude of neglected tropical diseases affecting many of the African countries.
All right. Now, you talked about close to 2 billion globally. Narrowing down to Kenya, talking about half of our population, 25 million, who are at risk of getting the neglected tropical diseases. I know you've touched on the fact that, it's given less priority, but looking at these figures and statistics, and also looking at those factors that you mentioned, the less priority, lack of proper funding, unlike the likes of HIV, malaria, and TB. So is there a likelihood of these numbers increasing? Because we can't also not be alive to the fact that it is there. This disease is actually with us.
Yes, if you sit down and do nothing, then obviously the numbers will go up.
Yeah.
But the government of Kenya, through the Ministry of Health, is working towards reducing these particular numbers that we are talking about. And in the next 10 years, probably we'll not be talking about the 25 million.
All right.
We may be benchmarking with the other developed world in terms of elimination, and just moving from the control status to a state where we'll be free of these neglected tropical diseases. So the bottom line is that if you don't initiate any interventions to control, then obviously you will see the numbers rise.
So there's actually hope at the end of the day.
Yes.
So in your perspective, do you think there's really enough sensitization being done in terms of also creation of awareness, also just for Kenyans to understand what kind of diseases are this and how they could be at risk of getting such kind of diseases?
Awareness is low of this particular disease, and that is why I said because the severity in terms of symptom is less, so at a personal level we may not be aware that we are affected with this.
So even as a person you wouldn't know?
You wouldn't know. So the setup, you don't know, but the impact is what you see later when it is already caused damage in you. So I would say that awareness is very low, except for areas where we've initiated some of the intervention. That is where maybe the awareness levels are high, but generally the awareness of these diseases is low in the country.
Yes. So we can agree that obviously now it means that we need to do more in terms of this question of awareness?
Very true.
And sensitization.
There's a need to enhance advocacy, community mobilization and sensitization, so that the people are aware of what are the risk factors, how can they prevent these diseases, so that we minimize also the numbers that we are talking about.
All right, well said. Now, 20 of these diseases are actually unique to us as a country, amongst a possible host of other kinds of neglected tropical diseases. Perhaps what kind of diseases are these that are unique to us as a country, also just for viewers to understand, and why so?
So thank you for that question. I want to say that out of the 20 listed NTD, the list keeps on growing. When I joined the
so instead
program,
of like reducing, it
yes,
just
keeps on increasing. Depending on how people advocate for the conditions, they add them to the list of the NTDs. I started knowing the NTDs when they were 12, they grew to 17, and by 2018 they added another 3. Now we are at 20, so probably tomorrow you may find it the list has grown to more than 20.
So it means you're really doing badly.
Yes, there are conditions that are very neglected. So depending on how the teams lobby at the global level, then they add them to the list of NTDs. So I want to say that out of the 20, only one is not regionally in Africa, and that is called Chagas disease. That is restricted in South America. So the 19 possibly are endemic in Kenya. And just maybe to highlight which are these 19 that are possibly in Kenya. So I want to start on a positive note that the country managed to eliminate one of these neglected tropical diseases called drunculiasis. The common name is guinea worm. In the year 2018. We were certified by WHO in 2018. So there's a possibility that we are able to reduce these conditions by the year 2030, in the next 10 years. So that one we've done away with, but it was endemic in the country. I want to help us know the diseases maybe from the public point of view, from the ones that are now not very much prevalent, and maybe to the ones that are now very much prevalent in the country. So the first one I'll be talking about is called human African trypanosomiasis.
This is not as much prevalent.
That is, yes, that is the name, but the common name is called sleeping sickness. So sleeping sickness was endemic in the western parts of the country. It's caused by an insect called tsetse flies. So it bites you just the way mosquito bites you and transmit malaria, the same way tsetse fly bites you and transmits the sleeping sickness. So in the last 10 years, we've not reported any case of human African trypanosomiasis in the endemic sites in the Western, and the country is looking towards certification of being free of this neglected tropical disease. The next one that probably we are in a better position to eliminate is called onchocerciasis. Onchocerciasis is also called river blindness. Again, it is an insect-borne disease transmitted by an insect called simulium flies. So these flies breed in fast-flowing rivers. So those fast-flowing rivers were also again in the western region. I know that will bring also these NTDs, they have domains where they are. So your NTD may not be, the NTD in Western may not be the NTD in the coastal region. And those in the coastal region may not probably those in the northeastern region. So the western region was also endemic of this river blindness. Again, in the last 20 years, we've not seen any symptomatic case. And through the Ministry of Health, we are seeking for being certified free of river blindness. So that brings us to 3 of the possible 19. What may come also in your mind is leprosy. Is also listed among the neglected tropical diseases. And leprosy is a disease of ancient disease.
All right, just hold it right there. We'll come to continue unpacking, this, the different tropical diseases, those unique to us as a country, and also understanding why at least 3 are down. But I want us to just take a very quick breather. When we circle back, we continue a pace with that conversation. Time for that breather. Stay with us.